during the crisis of the coronavirus and COVID and everything that has come out of it between, we really saw that there was a need, for resources and information, but also this feeling of a community that can deal with these larger questions. We're going to talk about a lot of kind of heavy stuff as well as some uplifting things. But I think one of the things that has really become clear is that this is really an existential crisis for us. And many people I know are being overwhelmed by news, by statistics, by things that we have never heard of. And it's a lot. So one thing I was hoping we could do before we get started is just to kind of ground ourselves, that even though we are on this tech platform, this digitalized way of life, that there is still a humanity in what we're doing, and to hopefully bring that into this conversation. So if you can, just sit back in your chair, put your hands on your thighs, put your feet on the ground if you can, and just close your eyes. And we're going to take 4 deep breaths. I know these are special breaths. So we're going to have you take 4 deep breaths with 4 seconds in. You're going to hold it for 5 seconds and then breathe out for 6 seconds. Okay, so we'll do the first one. So breathe in for 4 seconds. Now hold it for 5 seconds. And let go for 6 seconds. Okay, 1 more, 3 more breaths. Big breath in. Hold it. Big breath out. 2 more. Big breath in. Hold it. Big breath out. And last one. Big breath in. Hold it. Big breath out. And I wanted to just start with a poem that has been going around that we can put into the chat, but it's a poem by this holistic Wiccan, I believe she calls herself, in Western Mass, Dory Midnight, who wrote this beautiful poem called Wash Your Hands. And I just want to read the last paragraph of it. It is already time to remember to hang garlic on our doors, to dip our handkerchiefs in thyme tea, to rub salt on our feet, to pray the rosary, kiss the mezuzah, cleanse with an egg. In the middle of the night, when you wake up with terror in your belly, it is time to think about stardust and geological time, redwoods and dance parties and mushrooms remediating toxic soil. It is time to care for one another, to pray over water, to wash away fear every time we wash our hands. And so with that, I'm hoping that we can go into what I hope to be a very interesting and informational conversation, but also the beginning of the continuation of a network of people that hopefully will be able to answer the crisis that we face among coronavirus, but among the many other that are to come. So just to talk a little bit about the format of tonight. Obviously this is an overwhelming medical crisis, but like I said, this is also an upheaval of our socioeconomic life. I heard this term, a tsunami of our social life, which I thought was kind of really fitting, as well as an existential and a spiritual crisis. And, so how do we balance this sense of precaution with our needs for life? And a lot of the information here is the most up-to-date that we can find, but this information is changing at an unprecedented rate on an hourly, daily basis. So this is as updated as we can. And, while I work as a medical professional, a few of us other, especially Ariela, are medical professionals. This is by no means institutional advice. We're just offering the information that we know. And so please make your own choices in consultation with CDC, WHO, local health, political institutions, your own medical practitioners as well. And one of the other big things of tonight that we would really like to emphasize, and hopefully that will come out, is that in the news, it's very much talked about as a medical crisis, a public health crisis, which it absolutely is. but that this is so much more, and that we want to include the individual, what to do as an individual, but also as a community. And also shifting our focus away from just the thinking of in the next few weeks, but that this is a generational shift, I think, for our consciousness. So to begin that very huge and delicate conversation, we have three amazing facilitators who are going to help us wade through this information. The first is Dr. Ariela Zamcheck. She's a DO, family physician, currently studying at the School of Public Health at SUNY Albany and the New York State Department of Health as part of a fellowship program. She grew up in the Bronx in New York, received her BA at Oberlin College, attended med school at University of New England College of Osteopathic Medicine in Maine, and family medicine residency at Phelps Hospital in Sleepy Hollow, New York. She's interested in learning to shape public health practices to address health disparities. We also have Aileen Javier, who's a community health worker, outreach educator, family advocate. She's passionate about fomenting community health by supporting and empowering people to successfully navigate the local social and healthcare system. Experienced providing social support, culturally appropriate health education, and connecting people with the resources available in the community. She has a certificate in community outreach education and worked as a family advocate in Massachusetts. And then Jesse Marshall is a trainer and consultant around worker ownership and self-governance. He's a co-founder of Capital Bookkeeping Cooperative and works on self-organization and facilitation for Extinction Rebellion in the Capital Region in New York City, and has been living in Troy since 2003. And just for myself as your facilitator tonight, my name is Frank Coughlin. I work as an ER doctor in Troy, it's Samaritan, as well as in Berkshire Medical Center in Western Massachusetts. I did my residency down in Bellevue, which is definitely in the front lines of everything. And it's been heartbreaking to read the stories of my friends and old colleagues who are there going through what we hope does not happen up here. And I've been working with the sanctuary and the Nature Lab since the fall, working to build a Health Autonomy Clinic in the North Troy region. And this is JJ.
Whoa, sorry, you're all hidden. Hi, everybody.
Cool.
And I also wanted to say, like, I have, maybe some of you all have been on many video calls and things lately, whether with your family or for work or anything, and feel free, like, if you need to get up and move around or do some stretches in the bathroom too, please do that, because I know it is a lot to sit for this long. So yeah, if we see you stretching back there, that's great.
Cool. All right, well, great. Ariela, you want to take us away on the medical aspects of the COVID crisis?
Okay, can everyone hear me? Hi, thank you so much for the introduction. I just want to sort of piggyback on what Frank started and really try to ground us all in empathy. This time is so scary, so disruptive and strange, and we're being asked to do things that feel so unnatural and really deny our own sense of wanting to be close to each other and support each other. And instead we're being told to distance ourselves. And I just want to encourage us all to be really gentle with ourselves and really gentle with each other as we go through waves of emotions that we've never experienced before. I know that I've been struggling myself, and I know that a lot of us are as well. So with that being said, I want to dive into some medical information to really give us a common language and understanding of what this is. I'm not giving any direct medical advice. My resources are generally from the CDC, from the New York State Department of Health, and from the World Health Organization. All right, so to start, what is COVID-19? What does this even mean? So this is a combination of the words coronavirus, disease, and 2019. It's one of a large family of viruses, and as a family doctor, we often see coronaviruses in little kids. And we think of them as diseases that affect kids under the age of 2. What's really weird about this new kind of string of coronaviruses is that they've been really lethal to older adults. And the one that we're dealing with now has been given the name SARS-CoV-2, which comes from the name severe acute respiratory syndrome, coronavirus 2. And it was named this because it was found to be so genetically similar to the SARS outbreak that you might remember from 2003. So what scientists are able to do is actually go into the genetic code of the virus and then find its close family members. So there are a lot of rumors going around of this being a genetically modified virus that was created in a lab. In fact, we're able to trace its direct relatives so closely that it's almost impossible that this developed any other way than through the natural selection of the viruses itself. It was first seen in Wuhan, China in December 2019. That's when it was first identified. It's not clear if that's where it came from, but what we do know is that it looks also very similar to viruses that infects bats and pangolins, which is a type of scaly anteater, and it's thought to have made a jump from animals to humans. This is not unheard of. This idea of viruses jumping from animals to humans has happened throughout human history, but that is likely what happened in this case as well. What makes this virus also so unique is that we are not immune. We're used to different viruses like the seasonal flu, and for that we don't just have a vaccine, but we also have some level of immunity from having encountered this virus in the past. The fact that we have no immunity to this virus makes humans much more susceptible to infection. And some people will actually suffer severe disease because there is no treatment and there's no vaccine. And the fact is we're still really learning about it. Knowledge is in its infancy. So all of these factors combine to make this pretty scary. The good news is for the majority of people, it is mild illness, but I'm going to go into exactly how it's passed from person to person and who should be most concerned. So how does it spread from person to person? People catch this virus from other people who have the virus. What we know is that it's most likely transferred through droplets that come from coughs or sneezes or possibly even exhalations from somebody who has the disease. So somebody sneezes or coughs, and it goes into somebody else's nose or mouth. The other way it can happen is if somebody wipes their hands on their mouth and then touches a surface, and then somebody else touches that same surface and then touches their nose or their mouth. We also believe that asymptomatic transmission is also possible, and that's transmission by a person who has no symptoms and doesn't know that they have the virus at all, but then can transfer it to somebody else without even knowing. And it's for that reason that certain public health policies are being put into place and recommendations are being made, such as wearing masks when you're around other people, because masks don't prevent you from getting the virus, but can prevent you from giving it to somebody else if you don't know that you have it. So what do symptoms look like? Symptoms look like so many other very common viruses. The most common symptoms are fever, tiredness or fatigue, and dry cough, although many other symptoms have also been linked to COVID-19. And those include aches and pains, nasal congestion, even runny nose, sore throat, diarrhea, nausea, now loss of taste and smell, so many different symptoms that it can be very difficult to determine whether the symptoms that you might be experiencing are COVID-19 versus any other respiratory pathogen. Symptoms are usually very mild, but in some cases, especially in vulnerable populations, they can cause a dangerous disease that requires hospital-level care. And the fact is, we have so many vulnerable people that we are at this point really overtaxing our healthcare system. And a lot of what we're doing right now in terms of staying at home and staying away from other people is to prevent the disease in vulnerable people who will need hospital level care. So what do you do if you have symptoms? I have a runny nose right now. Do I have COVID-19? Maybe I do, but I shouldn't panic. The majority of cases are really mild and resolve within a week with home care. So if you have symptoms, whether it be a fever, whether it be a cough or a runny nose, stay home, isolate yourself from other people to the extent that you can in your home, and call your doctor if you're concerned. Absolutely, before going to see a doctor, you must call, because even in the primary care setting, all doctors are overwhelmed and at risk themselves of contracting COVID-19. So anytime you're going to go to a doctor, call first. If you are mildly ill, you can care for yourself at home. However, if you have emergency warning signs, then you absolutely need to get medical attention immediately. So don't wait. If you or somebody you love is experiencing trouble breathing or chest pain or confusion, that is not a reason to avoid medical care. If you need to go to a hospital, you need to go. Call first, call 911, and they will be able to triage you appropriately. Who should get tested and how do you get tested? So in an ideal situation, everybody would get tested. However, this being a new virus with new technology required to create tests, not enough resources are available for everyone to get tested at this point. So what's going on is there's a triage system by which people at highest risk are people who have close contact with a positive case, or healthcare workers or nursing home employees, people who are on the front lines, are prioritized for testing. And that's because it is really crucial to make sure that these people who are working with vulnerable patients are not themselves giving it to other people, and also so that they could receive appropriate care, and also so that the people caring for them could protect themselves appropriately. For every test, for the majority of tests right now, the person who is administering the test needs protective equipment, needs a mask, and needs gloves. As you probably have heard, there's a nationwide shortage of this essential PPE. And that's another reason why tests are not being done in the numbers that we would like. We would like to know what everybody's status in the entire country. But unfortunately, at this point, that's not possible. However, the good news is there is a rapid test that's just been developed that can give results in as little as 15 minutes. Many commercial labs have picked up the test, and it's possible that in the near future there will be more ease of tests, but that's not the case right now. And you should not assume that because you're sick or because you're worried that you can get a test. If you feel that you need to get tested, call your doctor, describe your concerns. If that's not possible, and you live in New York State, then the New York State Department of Health has set up various drive-through testing centers. And to get an appointment, you can't just drive there, unfortunately. You need an appointment. You can register online. I'm going to copy paste the link right now in the chat box. And that will link you to an intake form where you can put your symptoms, you can add your symptoms and your concerns, and there's also a hotline, I'm gonna copy paste that as well, that you can call. So that is one way that you can access testing. However, testing at this point is important for the people that I discussed, because if you are a younger person, you're less likely to have a serious illness. And in that case, it almost doesn't matter whether you have COVID-19 or the flu or anything else, because treatment is supportive. And supportive treatment means just the way you would treat a cold or flu or anything else, because there is no specific treatment available right now for COVID-19. So for example, if you have a fever, you can take Tylenol, you can take ibuprofen, and rest, drink lots of liquids, stay warm, get sleep. And if you develop any warning signs, those are the times that you need to see a doctor. But otherwise, since there are no specific treatments, the best thing you can do if you're mildly ill is to stay home and try to isolate yourself from other people. I just got the question, is this virus mutating? At this point, the virus seems to be pretty stable from one place to another. Viruses do mutate in time, but they often mutate in reaction to a treatment. And they will mutate to find a way around that treatment. Since right now there is no known treatment, the virus doesn't have as much motivation to mutate. So it doesn't seem that that's the case. I'm going to go a little bit more into, well, I just want to respond to another question that people have about treatments. There are many treatments being researched right now, but there's been nothing that's been approved yet. So there are scientific studies that are looking at treating patients with certain medications, some antiviral meds, and meds like sorry, I'm so nervous, I can't even pronounce the name right now. The anti-malarial drug, as well as azithromycin. However, these are experimental. They have not been approved yet. And they should not be mass used, and they should not be used by people who are not sick, although there are tests looking into post-exposure prophylaxis of some high-risk individuals who may have been exposed. There's also research that is taking the antibodies, so the cells that attack the virus from people who have recovered, and giving those to people who are ill to see if they can use the cells from that fight the virus from recovered people to fight the virus for themselves. And so, but these are still in the very beginning processes, so we don't know if these are going to be effective yet. So we sort of have to be a little patient with the process and not jump to conclusions about drugs that are useful when we really don't know all the answers. So I wanted to talk a little bit about vulnerable communities and what's being done to protect those vulnerable communities. So vulnerable communities are people with pre-existing conditions and people who are over 65. So pre-existing conditions can mean high blood pressure, heart disease, lung disease. It may mean an immunodeficiency. There are a lot that we don't know, but it does seem that the virus is most dangerous in people who already have diseases, diabetes included. The other vulnerable population that I would be remiss in not noticing are people with health disparities due to long histories of injustice. These are people, mostly Black and brown communities, who due to environmental racism, wealth gaps, and systemic inequalities are being seen in disproportionately high numbers. And as we begin to address the devastation caused by this disease, we would be remiss if we were not approaching this with the same lens of reparation that is necessary in building systems of care that include all people. So although younger people can still get sick and even die, it is much more rare for younger people to be affected. And with that in mind, the state of New York, in addition to most states around the country, have issued laws to protect these groups. In New York, if you're over 65 or have a pre-existing condition, the governor has passed a law mandating that you stay home and limit home visitation. Not that you're going to get arrested, although there are fines being put in place, but the recommendation is that you stay home, you limit visitation to necessary visits only. And it's recommended that whoever is visiting you should screen themselves, either take their temperature and not come if they have any flu-like symptoms. And also that you and the visitor should wear a mask for the duration of the visit. And this again is to prevent either the visitor from transmitting the virus to you or you transmitting the virus to the visitor. I got a question about whether mostly older folks were hard affected, now young and middle ages. So as we see more people get infected, we're going to see more numbers. This does not necessarily imply that the virus is mutating. It is just a result of high numbers of infection. Some people who are young and healthy are getting sick and needing to be intubated and cared for with high level interventions. and some older people are getting better and getting out of the hospital. It just, as we see more infections, we're going to see higher numbers of severe illnesses in people of all ages. This does not mean the virus is mutating. Why should we stay home? We talked about this a little bit before, but the best way to protect yourself is to keep yourself from getting infected. And the best way to do that is to stay away from other people. And that means to stay at home unless you're considered to be an essential worker. I know this is the hardest thing for most of us. We're a social species. We like to be around other people. It's very strange to not go to work and do our normal activities. But this is in order to protect yourself, and most of all, to protect the most vulnerable people. The other recommendation that we've heard a lot is to wash your hands, and wash your hands often. And soap and water is the best way to destroy this virus. I know it seems like the virus is so weak, but soap literally disrupts the virus's membrane and denatures it. If you actually get all parts of your hands washed for full 20 seconds, especially after you've been in a public place, especially after blowing your nose, coughing, or sneezing, and if you can, avoid touching your eyes, nose, and mouth with unwashed hands. The other recommendation is to put as much distance as possible between yourself and other people. If you're walking on a city sidewalk, keep at least 6 feet, because that is estimated to be the distance that droplet will carry if somebody were to cough or sneeze. However, now we're feeling that it's even more important to keep an even larger distance, because it's possible that the virus can last for longer in droplets in the air. Wearing a mask can help, but best to really keep a large distance between you and other people. And as I said, masks are now being recommended for all people when in public by the CDC because of the possibility of asymptomatic infection. There are some really fun guides on how to make at-home masks. You can make them out of t-shirts, you can make them out of bandanas, you can order them online. Cloth masks is what's being recommended for non-healthcare workers for going about daily activities outside. So it's important to try not to use face masks meant for healthcare workers, because these are still in short supply. I also just wanted to go into a little bit of the definitions of quarantine, isolation, and social distancing, because I think these get a little bit confused. The term quarantine is actually more of a legal designation, and this is the term used for people or groups who were exposed to a disease and have a known exposure, but don't have symptoms. So this is to keep them away from others so they don't unknowingly infect anyone. So if you are in quarantine, you'll likely have gotten a call from your local health department to let you know that you've been exposed, or you will know because you'll have a contact who's tested positive. Isolation is a term given for people who are already sick to keep infected people away from healthy people and prevent the disease from spreading. Social distancing is what we're all doing right now, those of us who are not in quarantine or are not isolated. And that is the public health measure that we're taking to prevent the spread of this contagious disease by maintaining a physical distance between people and reducing the number of times people come into close contact with each other. And the goal of this is to reduce the growth of the sickest cases in the hospital that are overtaxing our healthcare system. And when that happens, doctors are not able to sufficiently care for enough people, and people are not going to be able to receive life-saving measures in the hospital. And this is being now dealt with in numerous ways, but including increasing the number of hospital beds in hospitals all across the state, building field hospitals in New York City, the Navy ship that has 1,200 beds that are now being used for COVID patients, the Javits Center. So we're trying to increase our capacity as much as possible, but still, it's really crucial that we prevent the growth of those cases. And it seems, this is very early to say, but Governor Cuomo has been saying in the last couple of days that it does seem that this plateau that we're hoping for is coming, because there are less hospital admissions and less intubations. So this is really great news and very encouraging. It's still only a trend of 3 days, so we have yet to see if this will last, but you can feel very assured that the social distancing is making there be less cases. So it's not all in vain. I wanted to go over a couple predictions for the future. So when is this going to end? So one model says that there will be a peak and then a 4 to 6 week taper off where new infections decrease. It looks as though this is beginning to happen in New York, and Cuomo has just extended the stay-at-home order until April 29th. But I feel that that is very encouraging because it looks as though we may be in the beginning of that taper-off period. Exceptions may be made for counties with very few cases of COVID-19, and there may be those counties that have capacity to perform a large number of diagnostic tests and resources to trace infected people's contacts, which could also make people feel more confident getting out of their homes and actually getting back into life. But it seems that life will not be completely normal because we will continue to have short periods of increase in numbers over and over again, and we may have to continue to really protect the most vulnerable populations. The other thing that's happening is the development of serologic tests that can see whether somebody has actually had COVID-19 and recovered. So if you have the antibodies, then it may be safer for you to go out and work again and return to the workforce. And also the development of rapid tests can help to really quickly tell whether or not somebody is sick. And all of these are ways that we can get people out of their homes and back into sort of a more normal life. I'm going to start to, sorry, I'm just responding to a question from my father saying, confused because we just had the biggest number of deaths in New York City last night. So how are things getting better? So I know that this might seem a little bit counterintuitive because there was a great number of deaths in the last day, but it also is a result of a 3-day average. And also just because we're beginning to taper off does not mean that the number of deaths may continue to increase as hospitalization admissions decreases, intubation decreases. So it's all of these numbers together. And it's hard to look at one factor alone to determine whether that sort of taper off is actually occurring. Also, it may be very premature to say that. I'm really just going off of Cuomo's enthusiasm because it does look like there is a decrease in hospitalizations that has now become a trend. So I think that on that note, I might want to hold off and see if there are any more questions, but otherwise pass on to our next wonderful speaker.
Cool, great. Thank you so much. Thank you for all that information. And I know that was like just a tidbit of all the information that people have, but also I know everyone has tons of questions. We're going to try to answer at least some of the main questions that we've been finding. But maybe to move on to a next step, there's so much talk about the actual disease, and then the recommendations are just stay at home. And then what does that mean for us? How do we take care of ourselves? How do we stay sane and keep being social animals in the time of this kind of crisis? And so we wanted to have Eileen to come talk about some things that she's been seeing people in the community, but also for herself. And would love to hear what she has to say. So I'm going to unmute you.
Hi, everyone.
Great, take it away. Thank you.
Can you hear me? Okay. Okay, so my portion of the meeting is to talk about self-care. And self-care is something that we need to do to develop resilience and to feel good about ourselves. I break it down into the components that I see for myself in terms of self-care, which is my mind, my body, my soul / spiritual, and my social life. that's what I consider the most when we need to focus on that subject of self-care. I'm going to touch on little aspects because self-care is very unique and individual for everybody. What might work out for me might not work out for you, but I'm just giving you the tips that I use to keep my sanity in the times of COVID. I eat nourishing foods. I try to eat as fresh as I can. I try to buy my groceries fresh, and I did speak to Brenda this morning. I'm limiting my going to the groceries and buying in bulk and freezing the veggies instead of going to the supermarket and defeating the doctor's orders of keeping myself at home. So eat fresh foods, but freeze them and keep them to last you for a couple of days. I also meditate, and Frank, actually, I was going to do a little exercise with everybody, but he went ahead and he did it for me. This was not rehearsed. I was like, oh, damn it. He actually took my idea. Now I can't do it. So we did a little test of what is meditation. All you have to do is ground your feet. Focus on that, grounding your feet. If you can, try to take off your shoes. You're in your house. Ground your feet on the floor. Close your eyes. Breathe in and out. Focus on the breath, up and down. And if you do that, time it for 5 minutes. You meditating and you are recentering yourself to focus on your body and your connection with spirit. Also, we need to move. I know doctor's orders and everybody says stay at home, but there are plenty of things that you can do at home. I gotta give you an example. These are my videos. I'm old-fashioned. I actually have DVDs. I have a couple of videos that I have. But if you don't have DVDs, there is plenty of YouTube videos. You just connect it, you place yoga, Zumba, salsa. For the people that are in a couple, you can do even tango dancing. By the time this social distance and isolation ends, you might be tango dancers or salsa instructors. So see it in a positive way that you can still do things that eventually you're gonna laugh and look back at this and say, wow, remember in COVID-19? Yeah, that's when we started salsa dancing. I mean, that's some things that keep me going. Zumba. You can do Zumba. There is something that a friend of mine invited me, and also Melissa mentioned. Melissa and I haven't done it, but Zoom videos, and then we all can participate the same way that we're doing it, and we are working out together, alone in our houses, but together. And if all of that fails and you don't want to be participating in video conferences, I understand it's hard. It's hard for me too. I really dislike this at the beginning, and now slowly adjusting to the fact that I have to see people in little squares. So spend time in nature. Just walk. You don't have to be close to anybody. Try to respect if somebody's coming over. Somebody mentioned that when we run or when we get out of breath, we tend to breathe. Do what Ariela is suggesting, put your mask. So even if you cough or breathe hard, you don't spit by mistake, droplets of saliva, and then suddenly, oh, you see, she's giving us a little example. That's a cute one. But if you don't have any mask, all you have to do is put a bandana or a scarf. I have plenty of scarf. I don't have any mask, but I put a bandana or a scarf, and then I just go and do my run. I love it. She's showing another one. I'm going to that quickly. everybody please come back to make the mask. I want that will be here because I need to learn. I'm not so crafty to making masks. And going back to the self-care subject, because I can go off tangent, people here know that I love talking. So maintain your social connections as much as you can. You don't have to be with people physically to avoid unaware. Basically, my grandson, who is actually here listening to this Zoom video, he's waving. He said he wanted to be with me. And I said, I'm afraid that what if I have something and I give it to you? So it's unfortunately, this is a complicated illness, a virus, because it makes you concerned of putting somebody else in harm because of your own need to be with somebody. So in order to maintain our social connections, we need to be creative and doing the necessary evil that is the internet. I used to dislike the fact that everybody was doing, the phone all day long and never pay attention to the people next to them. Now, unfortunately, in order for me to be with you, I need to be looking at a device, but it's a forced evil. But in order to maintain the social connections, this is the ideas that I have. I told you already about the Zoom video calls with friends, but also I mentioned to my daughter and my cousins that there is a friend of mine from Extinction Rebellion. She said to me about this app called Libby, Libby. I'm gonna put it on the link for everybody so you can download it. You can download it free in the phone or in the computer. That app, Libby, you can download it, and even if you don't have a library card already, you can still have access to tons of books and audiobooks. So what I said to my daughter and my cousins, I'm gonna create a Facebook group where we can be together. I give the announcement. We basically choose one book. Everybody's gonna be reading the book or pick the audiobook. We read the book on our own, and then once a week we do the same Zoom video, and then we do a book club. So that way we can still connect with each other doing the things that we normally do. I love to read. And it's a way of saying, okay, on Sunday at 8 p.m. is my book club discussion. We can't see each other, but see it as is a necessary thing to do to save everybody from having this illness. And what else do I do? Oh, very important, this I do. And you can do it if you have a phone, which everybody does. This is what I do every morning. You see, I get up at 7 in the morning and I think of 3 things that I'm grateful every day. It doesn't have to be complicated. You just said, I have a roof over my, the top of my head. I have shelter. I have food. My family is healthy. Every day, focus on what you have, not on the things that I'm losing. At the first week of this isolation period, I was very sad and I was really, really discouraged and depressed. Melissa and a couple of people had to call me and reassure me these too should pass. My daughter reminded me, Mom, you're the most positive person. Come on, what's wrong with you? Come back. I had to take a cold shower. And this is a little ritual. It can help you too. Take a cold shower. As the shower comes in, it's super freezing. You basically imagine that this water doesn't have to be cold, it can be warm. It's cleaning from your sorrows, your worries, everything that is bothering you at the moment. And think about all the situations in your life where you have gone through, and you are able to get up. And if you focus on the things that you go through, I know that COVID-19 is unprecedented, it's something that we've never seen. But the people in the flu pandemic of the Depression era, the 1800s, some of them survive. And you can Google them, you can find YouTube videos. And if they did it, humanity, we are basically the strongest people. We have to find the resilience. That's what I do. I don't know if we have time. I think I touched all of it: mental, body, soul, spiritual, and social. Oh, one more thing. Please join Facebook groups, because you'll be connected doing things that you like. I have a Dominican cooking group, Puerto Rican cooking group. I have so many groups of people, and some of them I know and some of them don't. And it develops, make you look forward to that message. And also here there is some people from mutual aid, they're gonna be talking about it. I also encourage you to join Facebook groups that are from your local area, because you'll be informed and connected to the groups that are pertaining to your area, that can tell you access to connection, but also groups that you're interested in your local area. That's what I do to keep my sanity. At the end of our whole meeting, hopefully you can tell us some other stuff that I haven't touched and that you're doing to keep yourself happy in this moment.
Thank you, Eileen. Eileen, do you want to lead us in a little breath or a little movement?
Oh, okay. Okay, everybody, please put your feet on the ground. So you ground yourself. It's sort of what he did already, but it's okay to do it again. Just close your eyes for a minute. I'm gonna do something different. Please think of a person that you love for a moment. Visualize that person that you love. And that person that you love, think about all the good thoughts that you associate with that person. Now breathe in and exhale through the mouth. Do it one more time. Breathe in and exhale through the mouth. Every time you are stressed, try to breathe in and out, but focus on somebody that you love and focus on the thoughts that you associate with that person, and try to calm yourself and try to think of those thoughts, those loving thoughts, and redirect not only to yourself, but for everybody that you encounter everywhere you go. When you walk out, even in the distance, smile to your neighbors. Have them see that you are connected to them. That smile might make them feel special and might make their day, because these people might be isolated and alone, and just the fact that you acknowledge their presence might make the difference in their life. So that's all I have to say. And be safe, listen to your doctors. So we pretty soon be hugging each other and mix hugging everybody.
Wow, great. Thank you so much, Eileen. I really appreciate that. I'm sure everyone does too. And, obviously this will be recorded. And one of the things we're working on at the sanctuary is to have a resource page of all different things. And I know that there are a couple of friends who are doing like Facebook workout things that they're raising money for families in the Troy capital region area who are struggling, and among many others. So thank you so much for all that information. And then lastly, to kind of wrap up, as we move from the medical to the individual, is this idea of the community support. And we'll have Jesse talk about what is going on in the Capital Region and Troy Region. And right now they're working with the Capital District Mutual Aid Group as well as XR. But as Eileen kind of brought up, this idea of community support is as old as we are. And it has new names and it's changed a little bit, and now it has Facebook groups. But it's a very human need and a human response to tragedy. So with that, Jesse will talk about some of the things that they're working on specifically, among many other things that are going on in the Troy region. Right.
Great. Thank you, Frank and JJ and everyone who organized this thing. This is pretty moving. And it's surreal to be talking to you about this thing for 20 minutes to so many people, this thing that I only started like really thinking about or doing a couple of weeks ago. Because this is also fast moving and new. So yeah, I mean, that's sort of the first thing I wanted to say is that, you know, I've been doing different kinds of community organizing for a while, most recently with Extinction Rebellion, which is a group, a global movement focused on the climate and ecological crisis. But this project is brand new, and I am not an expert by any means. So again, I kind of got into thinking about this through Extinction Rebellion, but we very quickly linked up with other people and are now part of a growing coalition of individuals and community organizations all over the region who are thinking about a community response to COVID-19 and hopefully beyond. So I don't have close to a complete picture of what the community is doing around COVID-19. I want to be clear about that. What I basically have is an overview of I'm actually going to start with some political perspective because that's really core to what mutual aid is. And then I'm going to talk about some of the basic principles around mutual aid that have kind of developed over a long legacy of people coming together to have each other's backs. And then we're going to talk specifically about what's happening in the Capital Region and how you can get involved, or at least again, what I know about, what I can invite you into. I'm sure there's lots of other things happening. But it feels important to me to begin with a little bit of context, and Frank did a great job of this at the beginning, of talking a little bit sort of politically about where this crisis is coming from. Because it's certainly about a virus, but it's a crisis on top of many crises and many failures, and a long history of oppression and inequality. So as usual, our government's response to this crisis, unsurprisingly, this virus, this pandemic, has been to put retrenched power and corporate profits above the public good, right? So we saw our president spend weeks downplaying the virus in the hopes, quite explicitly, of keeping the stock market up, because that's his political weather vane and how he judges his chances for re-election. And then we saw government agencies that have been cut over the last decades and filled with political appointees lose a month in developing a testing kit for this virus, and so we're still without testing. Meanwhile, our hospital system has been privatized and reorganized to maximize profit by minimizing bed space and supply inventory rather than actually being prepared for disasters. And in parallel to that, our economy is oriented towards the profits of these big global corporations, which use cheap labor from formerly colonized countries to maximize their profits, again, while minimizing inventory. So we no longer have the capacity to manufacture PPE here in our own country, or produce testing kits domestically. And then there's what's happening to our economy and who's getting bailed out. So I was just listening to a radio story a couple days ago. The previous record for unemployment claims in a week in this country was 700,000 people in 1982 under Ronald Reagan. And in the third week of March, just a couple of weeks ago, we had 3.3 million people file for unemployment. The following week, the last week of March, we set the record again, doubling it, 6.6 million people in a single week filing for unemployment. So I know I'm telling you things you already know, but it feels like important to ground in this truly historic moment that we're living through. And yeah, I bring this stuff up just to remind people that this crisis is political. It's based on who's in power and who gets to decide whose lives are more important. And I bring it up for another reason too, actually, which is just to remind us that the source of this crisis is not just a mutation of this particular coronavirus. It's rooted in deep systemic failures that are not going to go away when we have a vaccine for COVID-19, right? These are the same crises that have brought us catastrophic climate change, that have produced rising racism and xenophobia, and a turn towards fascism. So I'm bringing this kind of bummer perspective that this is not the last major crisis that we will be facing together, where we will have to be turning towards one another. I don't expect things, even if they go back to normal for a little while, I think we're getting a little sneak preview of what life is going to be like, certainly for my lifetime. So more natural disasters, more failures of public systems, more economic instability. I'll take a deep breath there. It's never fun to give this message to people, especially when they're little boxes on a Zoom screen rather than flesh and blood people in a room with you. But I guess the last thing I'll say just on the bummer end is that I'm not a public health expert by any means, but I am personally operating under the assumption that we have not experienced the brunt of the virus here in the capital region, and that things are going to get worse before they get better. So we're already dealing with the isolation, the loneliness, the fear, the insane economy, and the loss of stability and jobs. And we haven't even really experienced what might be coming down the pike in terms of actual infection and sickness and the overwhelm of our healthcare system. All the things that we've seen happen all over the world. I have no predictions for what that will be like. But I find myself having to kind of remind myself every single day of that reality, because it's really hard to actually let it sink in. Okay, enough of that. Let's talk about the inspiring stuff, the hopeful stuff. So what is mutual aid? Mutual aid, it's hard to define mutual aid because it's actually just so basic, right? Like there's such a broad tradition of people helping each other when they need it. It's actually just kind of what we were evolved to do, right? None of us would be where we are without mutual aid. That said, there's a real tradition and a set of kind of principles and methods that people have been using really for centuries, actually, to respond in times of disaster and crisis when larger systems aren't there to support people. And so I'm gonna go through a few of the sort of basic principles. And the first one is that mutual aid, and this is actually a quote from one of the people who started the Common Ground Collective in New Orleans after Hurricane Katrina. Mutual aid is about solidarity, not charity. So if charity is sort of about rich people giving a little bit to poor people to make themselves look better in the eyes of other people or in the eyes of God or whoever, this is something very different. What we're really trying to bring to this work is the understanding that needing stuff is not a personal failing. First off, not having enough or what you need in this very unequal, oppressive society is a result of those systems, right? It's not because you're not good enough or smart enough or a hard enough worker. Secondly, we all need stuff, right? Self-sufficiency is a total myth. And so mutual aid is really about, rather than saving people or giving to people who have less or who are more desperate, it's really about recognizing that my well-being is bound up with yours. And you might want to help me when I'm in a tough spot because it's the right thing to do. But you also might want to do it because you cannot be truly well unless I am well. And this is kind of a special situation with this pandemic where that's kind of always true, but it's really obvious to us right now that you cannot be well unless I am well, right? If I'm sick and I think that I'm on my own and I go to the supermarket or the food pantry by myself, I infect you, right? If I'm high risk and I go out and get exposed because I feel like I don't have any other choice, I'll end up on that ventilator that someone else could have used because I had this feeling like there was no one to go to the store for me. So what are we doing here in the Capital District Mutual Aid Network, as we're calling ourselves, this motley assortment of crew who just kind of frantically started doing stuff together a couple weeks ago. So first thing, a few people, and some of those folks are actually on this call. I can see Christoph in my little screen, but I'm sure there are others. If you've been involved, you should raise your hand and I'll bring you in for the questions later. And I'm checking on my time here. How am I doing? Oh, I'm doing good. Okay. So a couple weeks ago, a few people basically set up a Facebook page and created a Google form for people to request help and offer help. They also started compiling what's become a really amazing list of local resources for people. So things like hotlines, food pantries, services. And so that is all going strong. And what we're working on now is this concept of setting up what we're calling neighborhood pods. And this is something that's happening literally all over the world. Tens of thousands of neighborhood pods are being set up. And a pod is a very simple idea. It's a group of neighbors, block by block, who are getting connected to each other and basically making sure that nobody falls through the cracks. And so we've created a guide for how to safely set up a neighborhood pod. The safety here is really important, obviously. Another kind of basic principle of disaster response is that doing something is not always necessarily better than doing nothing. And the same goes here. Like, we really don't want to set off to support our neighbors and end up accelerating the spread of a virus in our community. So we take safety really, really seriously. And so the idea of starting a pod is that a small group, say 5 to 30 neighbors, are connected in a phone tree or a Facebook group or a messaging app. And step one is just we're cutting the loneliness that way, right? The isolation that we're all experiencing. Second thing is that we can start to really localize support for one another. So those tasks that sick or high-risk people need help with, things like grocery runs, picking up prescriptions, those are things that our neighbors, if we're building the trust to be able to do that, can do for one another in a way that actually slows the spread of the virus rather than accelerating it. And again, the key here is safety. So we're setting up those pods. We've created this resource. We're about to put out a call on social media for that. And we're gonna have some orientations for people. Again, some people who have never set up pods before, making some suggestions based on research to some other people who have never set up pods before. So it's all very reciprocal, and we're building our wisdom together as we go. Second thing, or rather, I don't know what number I'm at. I think I'm at like number 4. Fourth thing we're doing, we'll just say, is that we're going to try to really get together online and organize meetups and classes to deal with isolation, to offer support, to do mental health. So again, this is a broad call to the community. Our role, as we see it, is to make that call and help people who have the skills and resources to offer to the community to get on Zoom or whatever the platform that makes sense is, and then to publicize. So we just want to be that connective tissue. There's so many resources in our networks, in our communities, around connection and mutual care and mental health and physical fitness and all the rest of it, friendship. And so we just want to, and it's already happening organically. And so we're not adding anything other than hopefully expanding people's reach in the community with that online connection. Then fifthly, we're starting to talk about a system to help people give money directly to those who need it, who are in real emergency situations. That's a really interesting project. There's people doing stuff all over the country around that. Something I'm really excited for. And then lastly, we're having conversations about advocacy. So if we're all building relationships and connecting with one another to support each other, learning how to make decisions together, getting to know one another better, how do those relationships turn into more power for our communities in the long run? So how are we, basically building a movement out of this work, or contributing to movements that already exist, because there's obviously lots of good organizing happening already. So yeah, those are the broad strokes of what we're up to. I want to spend a few minutes talking about how you can get involved. Number one thing is start a pod. So we're having a Zoom call this Saturday at 4 p.m. I literally made the Zoom invite while Frank was talking at the beginning of the call. I'm going to put the link in the chat now. And hopefully we can do like a follow-up email as well. Oh, here it is. Here's my chat. So there's a registration link to this phone call that we're having at 4 p.m. on Saturday. The confirmation email that you will get to you when you register will have another link to this how to build a pod guide that we've created. Basically, after looking at like 20 other how to build a pod guides from groups in Portland and Seattle and New York City and Idaho, Iowa, all over the place. So that's the first thing you can do. And I want to encourage you to make a list of 3 or 4 or 5 friends who come to mind as people who would also be good to connect to their neighbors, and try to get them on the call. Second thing you can do is offer a class or a gathering online. If you've got something that you would like to offer to the community, we will find a Zoom account for you. We'll give you any training that you need to offer it, and we'll post it on our Facebook page, which right now has about 550 followers. And hopefully, we're building lots of partners who will also be sharing this stuff. Thirdly, think about giving direct aid. You may already be giving to an organization that's providing direct services. That's awesome. There's something really powerful too about unmediated giving, about giving directly to people in your own backyard who need help. So we're working on that platform now. It should be up quickly. So think about that. And then, yeah, those are really the main ways. Well, then our Facebook page, I'll put that in the chat as well, because that has a link to the form if you'd like to get involved. We need people forming pods. We also need people just helping us coordinate this thing. We're all just kind of figuring this out as we go. So people who are good with other people who are good with spreadsheets, people who are good with Facebook, we need help coordinating and supporting the community and basically coming together around this. So here's the Facebook page. And then the last thing that I want to say is again, sort of circling back to the personal for me. Ultimately for me, getting involved in this is about the relationships. There are major gaps for us to fill here, obviously. Our communities are extremely vulnerable in this moment. And so our proposal is that let's do that filling in of the gaps in a way that leaves us closer, leaves us more trusting, leaves us more united when this pandemic is over. We have such a culture of individualism. We are very segregated. We are very divided. And so the project of coming together around this in a stressful time, I doubt it's going to be easy. It's probably not going to be pretty all the time. But for me personally, in this moment, I can't think of anything else that I would rather be doing than trying to figure this out. So thanks for listening. And again, thanks for the organizers for doing this. And I'm sure I'll see you all on Zoom soon. And I'm also not, I'm asking like I'm hanging up. I'm not hanging up. I'm going to be answering questions.
Great. Thank you so much, Jesse, for that. That really great, great outline. So we have about 10 minutes left, maybe 8 minutes. I know there are a million questions. We have a lot of questions that people actually sent in on the form. And so I was hoping to just ask a few kind of general questions that, I personally have been getting as a medical professional, but then that I know a lot of people in our communities have been asking. So if it's okay with people, I'm going to kind of facilitate the questions. This is also one part of a multi-series of events that we're going to do. So, you're not going to get all the answers for this existential pandemic in 1 hour and a half, but hopefully over 9 weeks, we'll be able to do it.
Could I offer can I throw a loop in this?
Sure.
I guess because it's so weird to me to like not be able to have time and space to interspace. So I guess I would prefer if we could vote, like, do we want to, the questions that we're going to put out right now, do we want to read them from the questions that people pre-submitted, maybe choose 3, or would we rather the folks on this call, if you have a burning question, answer maybe 3 of those questions? So raise your hands if you would prefer we do the pre-submitted questions. Raise your hand if, or let me check the other screen. So many screens. Raise your hand if you prefer if we could open it up for folks on this call to ask maybe 3 questions. Okay. Sorry, Frank. Okay, are you cool with that?
Take it away.
Have problems sharing the facilitating power, clearly. All right, raise your hand if you had a question that you would really like to ask on this call. Eileen? I think I saw Eileen's. Do I have to? Oh, here. Okay. Okay. You're on mute, Eileen.
Okay, it's a question that other people have mentioned, friends of mine. So either Frank or Ariela. So a person goes and gets tested. Now they know they don't have COVID-19, but then this person hangs out with the neighbor. What happens next? And I got a couple of friends that knew about this phone call, but they couldn't come in. And by the way, I hope this is recorded because that way I can send them the link. But the question was, I get negative, but then what will happen if I get it? So I don't know if you understand it. What happens then?
I'm happy to address this if you want. That's okay, Frank. So Eileen, your concern is absolutely on point. If you test negative, great, stay home. Every interaction you have with anybody is an opportunity to get infected. So in hanging out with other people, that person is absolutely putting themselves at risk. I mean, it might be good to know if he's home already with older relatives or with people with pre-existing conditions, then like it might be really reassuring for them to know that that person's negative. But absolutely do not go and hang out with other people assuming that everything's fine, because one of the things that is being seen is this concept of asymptomatic transmission, and it's scary, I know, but I might have it, you might have it, we don't know, but we might be okay, but other people might not be. So we still all have to abide by the same recommendations of staying home. Does that answer your question at all?
Mm-hmm. Yeah.
I mean, the other thing that might be good for that person, if they're a healthcare worker, they could feel better about going to work knowing that they're not an immediate risk to their patients. So there are some reasons why it is really important to know if you have tested positive or not. But if that's not the case, that person should definitely not be hanging out with other people.
My mom, PCA, actually asked the question, was one of the people, because she visits different elderlies. So that's why she was concerned, but I will pass the message.
So there are reasons why we sometimes need to visit other people to give some essential care, to bring food. And the best recommendation I have for that is wear masks, absolutely wear masks. Wear gloves if you're touching other people or dealing with cleaning other people, and wash your hands frequently. There are ways to protect yourself, but preferably, especially if your mother's older, you should really stay home, as hard as that is.
Thank you.
Let's see. Great. Thank you. Adam, it looks like you had a question. And I think we can have time for one more question and then just some announcements.
No, I was raising my hand to vote on the initial question.
Cool. Great, thanks. Okay, anyone, one last question? If you, Norman, do you have a question here?
I've received all, am I unmuted? Yeah. All kinds of confused and conflicting information about what to do with takeout and stuff coming in my house. I just all different things to do. And I'm in New York and you do takeout. You sure the same thing, I guess, you know, and we do that. So how scared am I, my Chinese food that comes in? How scared am I?
So Frank, do you want to take a crack at this? Or do you want me to take it?
Are you?
All right. So I've been talking to a lot of friends about this. Transmission from food is one of the least likely routes. There has not been a proven transmission from food that's been found. However, as I said, somebody can touch your food, touch the wrappers, and then you can touch it, and then you can get sick. So the same precaution you use with anything else, use with food. There are food safety regulations in place, and you can check your restaurants that you're ordering from to make sure that they've complied with food safety. Sorry, there's a lot of echo. So just turn on your mute if you're not talking. But so what you can do is wash your hands after you touch the outside wrappings of the food containers thoroughly. But I would not stop ordering from a restaurant because of fear. In fact, restaurants are suffering terribly right now because they've had to close and go to an only delivery or takeout model. So we really, if we can, we should be supporting restaurants as much as possible. There's a great Times article that really looked into a lot of research that drove home the concept that transmission from food is very, very rare. The major concern is on the outside. As you know, you can't make any assumptions, but most likely transmission is direct contact with other humans, less likely food.
Great, thank you. I think we have one last question. Anastasia, did you have a question?
I'm trying to make sure I'm not muted. Can you hear me?
I got you.
Hi, everybody. A question. This has to deal with, let me turn down my other source in the back. Sorry. Okay. I'm sorry about that. I've got multiple things going at the same time. Question. When someone is tested, is that test only valid for the day that you took that test? We say 24 hours later is when you get the results back, or 48 hours, whatever it takes. So it's like on that particular day you may test negative, but that doesn't necessarily mean that the next day that you can go out and get it. Which is what I think people are misunderstanding. They're thinking that because I tested negative, then I'm good. You know what I'm trying to say?
Yeah, just to kind of, Ariel, you doing it?
All you, Frank.
Oh, just to really briefly talk about that, because it's the testing is actually probably overemphasized at this point, and that there's a thing called a false negative. So about 30% of people who test negative, it's a false negative. So they actually have it. So right now they're doing 2 or 3 tests to really, if you really wanted to verify that somebody has or doesn't have it. So that's why what Ariela is kind of saying is, if, yes, it is on that day at that moment, but if you get your negative test and then you go hug somebody next door who has it, you'll get it. And just because you have a negative test does not mean that you don't have it. So if you do feel symptoms, you should isolate, and you should, if you feel well, you should follow the social distancing guidelines at this point. So I know it's like a little confusing in the media, but yeah, that you're right about that. Great. Well, I know there's tons of other questions. I'm sure we have a lot of other questions to ask, but just to be respectful of everyone's time, thank you all so much for coming, for spending this hour and a half with us. Thank you, Ariela. Thank you, Eileen. Thank you, Jesse, as well as everyone else who's helped put this together. And just some quick announcements. Again, there's the Google form that we shared at the beginning of the chat to sign up to receive news about things that are going on at the Sanctuary, as well as the Health Autonomy group. And also, the Sanctuary is among other groups that are really struggling at this time. So if you have a chance, if you're able to, please go to the website to donate, and you'll see the donate button there. And on the 21st of April, a friend of ours, Eileen, who's a nurse in a local hospital, is going to be doing a DIY mask making Zoom call. So we'll send out more information. So please sign up to get information about that.
Yeah, and she's been making, like, I think they just made 400 masks for Joseph's house in Troy, and they've been making masks that hospitals are accepting. So she's going to talk about that network, but we also have like PDFs of how to make the masks and things like that we can share with you if you sign up for the list. But I just really wanted to quickly say, like, thank you to the Sanctuary. Like, they've helped us by facilitating this Zoom software and backing us up on a ton of this, and it's like so amazing to get to plug into that network and see all of your faces here. I'm feeling really grateful for that.